So let's start with current state of data science and healthcare. So you're doing a lot of things. What is, I don't even know how to frame this question other than to say, broad question, current state, what is it?
Current state of data science is we're jumping into it and we're doing as much as we can, as fast as we can. Basically we've jumped on the horse and we're charging off wildly in all directions.
So people recognize the need for it, but they don't know what direction to point it in yet. Or are they finding ways to do it and they're sort of experimenting in a lot of different areas?
Well, just like anything, even bringing in, data visualization and analytics as we did, there's some that are at a higher maturity level than others. And what's really good is it's been recognized, it's legitimized. Many organizations have legitimized, data science and the application of, data science products. So that's the good news. The not so good news is it's still the wild, wild west. There's still a lot of organizations that are hiring folks really without a problem to solve. I want to get into data science. I want to do predictive analytics. Let's hire a team. It's kind of like the religious movement of data governance a few years back. We all know what that looked like.
Yeah, and you're like smacking me around here because I am one of those people who hired 3 data scientists. I put them in a group, and I said, all right, we're gonna, and they were like, oh, we know what to do. And I checked back on them 6 months later, and they were writing reports, and they were buried in places of the organization. And I realized you really do have to lead this. And so, what does it look like what does a leading health system look like that is applying data science today?
Sure. So that is the key word that you said was applied. They understand that there is a need to apply that which is the products that are developed in a data science program. They actually have they actually have a program in place. You remember when we started with the 30-day readmissions?
Yeah.
Can you predict 30-day readmits? The first question that I asked when I was asked that, I said, yeah, absolutely. But do you have a program in place to address those patients that we discover that are likely to readmit? Because if you don't, we've got a problem. We've got an ethical problem. We've identified people that we're not going to be able to take care of. And then, secondary to that, we've just performed a statistical exercise. I'll predict them. We'll see if they readmit, and we'll just keep some stats. So you really, really have to think this thing through. And you have to have a plan in place, and you have to have, objectives, clear objectives. Why are you doing this? Not just because, my healthcare organization neighbor down the street now has a data scientist. I want one too.
Yeah, I mean, you make a good point there. So I was talking to a CIO, and we were talking about in the consumer area how the chief digital officer, the CIO, the ops, the COO, and the chief strategy officer need to almost be tied at the hip, because one begets another begets another. I mean, they're also so closely linked. But in the data science world, the same thing's true in terms of operations. Everything you're going to be analyzing is going to kick off something. You're going to find something out, and it's like, all right, now what do we do? We know the people that are going to readmit. We got to put a program together.
Yeah, so it covers operations, it covers clinical practice, it covers finance, and if the organization happens to be tied to research, you have a research component of it as well. And you're absolutely right; they all have to be, tied at the hip.